What do we got?
All right, we got one of your former patients called in for emergency treatment. She is currently pregnant and baby is in breech position. So she's wondering if you could do any points on that to help the baby, get to the right position.
So to turn the baby.
Yes.
Yeah.
And
She's due now.
yeah, in like a month.
Okay.
Yeah, next month. She said around June, mid-June.
Mid-June. So the baby's breached, but she wants to start trying now to turn the baby.
Yes.
All right. Any back pain? Any?
Yes, she has a toddler, so she's running after him, picking him up, lower back, but mainly also full back. She also wants to work on her acid reflux and just overall wellness, hormones, because she's going through it. She's pregnant.
All right, prepping for the baby. All right, let's see if we can bring you guys in on this one. A former patient of mine who I saw a few years ago who was to induce pregnancy. She was late. So it's interesting to hear her story, hear her tell her story on what happened. So we'll go ahead and check that out.
And it was like I saw you 5 days in a row. And then that last day you were like, you're gonna have him today. And I did, so.
Now, she's about a month out. We cannot do some of the contraindicated points for her because she's not ready to have the baby now. So right now we're just going to do some nourishing points, and we're also going to do some points for breech, which is really cool. So this is UB67. You can see I'm putting in the points in here, and that's on the tip of the pinky toe. So I had to use a smaller, pretty sturdy needle. And then once we get these set, we're going to actually use the smokeless moxa. We're going to use the kind that you don't need the tray for. So I'll put the smokeless moxa on there. I'll torch that. I'll light that up. That'll burn, and we actually do 2 sets of that. So we'll show you what that looks like once it's done. And once we remove that, we'll have her come in once a week until she's probably ready, which sounds like she's about 30 days out. Again, I'm in orthopedics, so I don't do a huge amount of breech or induction, maybe 1 or 2 a year, if that. If you are pregnant or if you are seeking acupuncture for pregnancy, best thing to do is just look up a women's health provider for acupuncture. Like, we're in San Diego, so I think Push is probably the one that we refer most of our patients to. That's Deb Davies here in San Diego, and see you on the next one.